we've had, through all of our education and job training and workforce programs since 2019, $12 billion. Obviously, a lot at our state colleges, which we're proud of, has gone into that, and the results have been very, very positive. But the nursing in particular, so that was something that we had always talked about on a certain extent. But then when COVID hit, you had this massive shortage of healthcare and nurses around the country. So it got to the point where, you'd have like a COVID wave in New York, and then you'd have a COVID wave in the Midwest, and then the Southeast. And it wasn't, it was regional, and it was even seasonal the way it was going. Well, if you have more hospitalizations in one area, you need more people. And then if the nurses are getting infected, then they've got to sit out until they get in. You have all these things happening. So you had a cottage industry of these like private nursing companies, I guess, where they would be like going, and these nurses were making a lot of money. So yeah, if you're willing to move to San Francisco for the next 3 months, you'll get $30,000 a month or whatever. And like, yeah, we're going to do that, right? So people were doing that. So it's like this battle to be able to get nurses and to be able to go. So my mother was a nurse for 40 some years. They weren't paying that much money then on these things. And she was very good too, so she would have commanded that. But I mean, it just got to be, it was like really crazy. Honestly, a lot of the hospitals are like, we need more people, we need more people. So that kind of really highlighted the issue, that we had there. So we, partially because of that experience, we've launched programs to be able to do it. So we launched 2 major programs. Our LINE program, Linking Industry to Nursing Education. This program's a competitive dollar-for-dollar matching grant that supports partnerships between educational institutions and healthcare providers. And so the money that is dedicated to that can give scholarships to students who meet requirements, recruit faculty to teach, purchase equipment, and to support simulation centers. You actually see, I was walking in here, I thought it was a real person in that bed. It's a mannequin. I'm like, oh, okay, so you do that. And so we've had that. We've also established the pipeline program, prepping institutions, programs, employers, and learners through incentives for nursing education. And that's to reward performance and excellence amongst our post-secondary nursing programs. So the funds for that go to are based on the number of nursing education program completers, first-time National Council for State Board of Nursing licensing examination passage rates, and excellence among nursing education programs based on the average of first-time passage rates above the national average. And so both of those have been really good, and that's why we're here today. So I'm proud to announce we can now say that since the inception of the line and pipeline programs in 2022, Florida has invested close to $500 million to support nursing education and address this vital need. But even better, today I'm proud that we are able to award an additional $20 million funding, 14.5 colleges and private post-secondary education, and $6 million to our state universities. And if you look at what we've done in both of these programs, I think we probably are now, just for what we're doing, and I know there's been other things in the private sector, whatever, we're now producing 1,000 plus additional nurses than we were before those every year between our state colleges and our state universities. And so that's a meaningful increase when we were probably, about, what were we, 700 for what were we for state colleges?
We were about 4,773, and now we're at over 5,100.
Yeah, so over 5,100, yeah. So, and then the state universities, we've gone up even more on the state universities. And so, and these are different programs, and there's different things you got to do depending on it. But that's an increase, significant increase on a percentage basis, and that's really, really meaningful. And obviously, part of that you just have to do to keep up with population growth and some of the other things that we've seen in Florida. We can also say that more than 85 million has been awarded since 2022 for our line funding, $61.5 million to state colleges and $24 million total to state universities. So that's throughout the inception of the program. So what we're doing, the $20 million this year is a big chunk of that, and that's really, really meaningful for a lot of these programs. Since 2022, $400 million in pipeline funds has been provided to post-secondary education, $240 million for state colleges and districts, and $160 million for state universities. So those are really to address the nationwide nursing shortage. It's very important. St. Pete College partnership has resulted in $340,000 in total anticipated line investments, including $160,000 matched by HCA Florida, $100,000 by Baycare, and $80,000 requested for 25-26 matched by Baycare, Advent Health, and HCA as well. So line funding helps places like St. Pete College better serve working and part-time students, ensuring more Floridians can enter and compete high-demand nursing programs while gaining that hands-on real-world experience. And look at the results. St. Pete College's National Council licensure examination pass rate for the most recent year we have record was 94.1%. That is much in our overall. That's much better than the overall passage rate in Florida, which is 83%. And so it shows you that at St. Pete College, they're getting the job done, and we really appreciate that. University of South Florida across the Bay awarded $23 million through Pipeline and Line over these years. And they've received $3.6 million awarded through the Line program that has been matched in full by community partners, including Johns Hopkins All Children's Hospital, who also donated $1 million on top of those matches. And so we really appreciate their, and honestly, it's in their interest to do this because they need to make sure that they have a qualified workforce, and they don't really want to get involved in these bidding wars where they're having to pay whatever. I mean, it really was, I mean, that 18-month period, I don't know that you've ever seen anything like that. That was a really big, so they want stability. They want to make sure that they hire good people, that they can be there and not constantly have employees be poached by their places around the country. So it's in their interest to make sure we're producing an adequate supply here. Now, we recently announced our budget that we would have $130 million to support nursing education and workforce initiatives, $100 million for pipeline, and $30 million for line. So the mission continues. We understand the need is there. We understand that we have a growing state. We also have a demographically more advanced state. That's just kind of the nature of it in terms of what we're doing. It's part of the reason why you have so many Hoosiers in Naples and Marco Island, because they work there and then they're able to retire at least part-time in the Sunshine State. And even though it's a little chilly by our standards now, I would not want to trade the weather in Pinellas Park for the weather in Bloomington, Indiana right now. I just think it's likely to be a lot colder. So you see why the appeal is for people to be able to come and be able to do this. So I want to thank the members of the legislature who were involved with launching this. I think we launched it under Wilton Simpson and Chris Sprouse, who both from the Tampa Bay area back during that time, and that was really fantastic that they were able to do it, and we've continued to see success for this. And so, ultimately the results speak for themselves. We're producing more quality nurses. We've got strong performances at places like St. Pete College, and so, you still hear about workforce needs for healthcare. It's not like the issue is totally gone, but I would say the decibel level has been muted from where we were a few years ago, where this was like something that they would always talk about. They have seen some improvement in this because of the efforts that we've been doing here today. So I'm excited for this. I'm excited to award the $20 million.